during the med math exam practice quiz type thing, I handed out these things. Anybody know what they are?
Belts.
These are called a gait belt, okay? This is your lifeline between you and your patient. This is what you want to have on them anytime you are transferring a patient from one surface to another, or even if you are ambulating with your patient. Okay, because remember, we don't walk patients, we walk dogs. We ambulate patients, okay? So, Mr. Kenny, I'm going to show you how to put these things on if you've not put one on before, okay? There's one side with a nice bit of teeth, okay? You want to make sure you're going in the right way so that these dig into the fabric so that it does not slip. Lots of places now are utilizing the plastic, like clips forms of these. I hate those because here in Arizona we have very dry weather. Plastic does not do well over time here, and they can break. And if I've got this on my patient, I want to know that this is secure and it's not going to break on me. So I always go for the metal ones. That's up to you, however, okay? But we're going to take it and put it around the smallest part of our patient's waist. And that's typically like right below the rib cage, all right? We don't want to go above that, mainly because one, will restrict his breathing, and two, it'll just shift down, okay? So I'm going to come in tooth side first and get this to where I can put at least 4 fingers in there and it's nice and snug, okay? Because I really don't want this to move. I want it to stay where I put it. Now, with older ladies, oh, and then I'm going to come around like this, okay? I'm not going to go all the way in because I want it to not catch. With older ladies, and the girls have kind of, you know, migrated and deflated, okay? It happens. We do not want to put this over them. That would not be good. Like guys, that would be like putting a jock strap here and going, okay? Not fun. So just if you have to, have them lift them up and put it around their waist, okay? So now, go ahead and face that way for me. I can have total control of Kenny. Go ahead and lean forward. Oh, why did that not work? What did you do to it? What did you do to it? I have never had that happen.
You left slack on it.
All right, well, let's do this then for sure now. We almost lost. They killed Kenny. No, wait a minute. Mama. Now. Let's see. Yes. More now than ever. All right, so I have control here. All right. Well, now I do. One thing you don't want to do when you're grabbing or holding onto the gait belt, hold from underneath, because if they fall, they're not going to fall up. Okay, so holding them this way is not as secure, because if they fall down, which they should with gravity, you could lose your grip. Okay, this way, again, it's just going to stay in your hand. All right, so just what?
As long as you land on top of it.
But now, can we stop somebody from falling? You're supposed to assist them down to the ground, okay? So if I'm ambulating Kenny here, all right, one, I don't want to be directly behind him, because can I see where I'm going? No, so you want to step off just to the side, basically kind of like line up your center with their shoulder on the weakest side, okay? And for right now, just for ease of seeing, we're going to pretend that you have a right-sided weakness, okay? And we're ambulating, and all of a sudden he decides to tilt forward towards the right where he's weak. I'm going to pull him back towards me. I'm going to take...
I got scared.
I got you, buddy, don't worry. But I'm going to tug him back and pull him back towards me, so that way I can put my opposite, like this is where my dance training from my initial year of college comes in. But you want to put your other, like the non-dominant foot that you're like have your weight on behind you, so that you have a nice broad base of support. And you're going to bring your patient back towards you and have them slide down your leg. So go ahead. And you're going, I got you, don't worry. Okay. And you can kick your feet out from underneath your feet. Okay.
Like literally fall.
Yeah, exactly. Okay. The whole time I am trying to control and keep him from hitting his head. I'm going to let him fall. I can't hold him. Okay? But I'm protecting his head from hitting the wall, the floor, the side rail, any of that stuff. Okay? And I'm going to stay with him until I can get somebody and have them come help me. Okay? All right. 1, 2, 3. Oh my God. Enable in process. All right? So what I want you guys to do now, hopefully you've made some friends, but I want you guys to practice at least putting on a gait belt. Tight. Now, one other thing too, depending on your patient's size, you might have quite a bit of leftover here. We don't want to leave it dangling, because when you go to transfer them or anything like that, it can get caught in the side of the wheelchair or in the side rail of the bed. So you definitely want to kind of tuck it away so that doesn't happen. The other thing too, the buckle, you do not want it completely in the center here or in the center of the back. All right, mainly because if it's in the center here and he bends over, it's going to dig into his skin and all that fun stuff. If it's off to the side, it's a little bit easier for him. Okay. All righty. Go ahead and get with your partner. And again, don't let them fall.